questions in the clinic from mothers asking about if their child suffers from food allergy. It's a very common problem among children. Many children, they have food allergies, and especially among some common food items, which are the dairy products, cow's milk, egg whites, seafood, nuts, soya, wheat, chocolate. The reason of this allergy is that the immune system produces some antibodies against certain food types. And this interaction between the immune system of the body and those allergens produce some symptoms in children. So they might suffer from runny nose, from cough, from rash, hives, diarrhea, cramping, abdominal bloating, even bloody stools. And it can reach sometimes to life-threatening conditions, which we call anaphylactic shock. Diagnosing food allergies is not easy. So, because there are many medical conditions that cause the same symptoms. So it's a challenging thing for the mothers or the parents as well as the pediatricians. One of the tools that all pediatricians can do is to do the elimination diet, which he stops or advised to stop the food that are suspected to be allergenic to the child for a couple of weeks, and then see if the symptoms disappear. And then after this disappearance of those symptoms, then he will introduce one by one of those food allergens to the child and see if the symptoms resume back or not. And then he will know which type of food he is allergic to. Another way of also diagnosing food allergies is to do some lab tests, like a blood test or a skin prick test. These tests are usually done in the clinic, and it's very important to know the type of allergenic food to the children. There is a way, of course, of treating it if the child is allergic to one or two food items. It need to do some immunotherapy for that, which usually takes 2 to 3 years, by injecting the children or giving some tablets of the allergens, small doses of the allergens, so the body will start to get desensitized from those allergens, and when he's exposed later on to those type of food, he will not have these symptoms. Sometimes it's challenging when the child is allergic to many food types. In this case, the pediatrician has to find some food alternatives that can replace those allergenic food, and to make sure that he's providing the child with a balanced nutrition.